Today we're going to talk about 7 different foods to avoid if you have acid reflux. Let's talk about it. What is acid reflux? The medical term is gastroesophageal reflux disease. All that simply means is that there is a reflux, which is a movement of acid from the stomach into the esophagus. Let's talk about how all these things work. Every time you start eating something, you begin to chew on it. After that, you swallow it. It goes through this tube, which is your esophagus, then it goes into the stomach. In the stomach, the body produces acids and enzymes that breaks down the food. Then after breaking down the food, processing it, it moves it over to what we call the small intestine. In the small intestine, that is where more processing of the food takes place. Then there is an absorption of nutrients and liquid. Then after that, it moves over to large intestine. In the large intestine, that is where the remnants or the remaining parts of the processed food is being processed to be released as poop or feces. When it comes to acid reflux, acid moves from the stomach into the tube connecting the mouth and the stomach. When this happens, you will have severe pain in the middle part of your chest, and it feels like the pain is moving from your stomach into the back of your throat. This typically happens after a few hours of eating. You may end up having abdominal bloating and feeling very uncomfortable. Sometimes people may have cough, which manifests itself at nighttime and also in the morning. If you have underlying asthma condition, this can also be a trigger for an asthma attack. In a very small population that have very severe symptoms and have a chronic condition of acid reflux, there is a possibility, a very small chance of developing esophageal cancer. And this is because of the changes in the lining of this esophagus. Now, let's talk about the foods to avoid. Number 1, coffee. Yes, coffee. Caffeinated or non-caffeinated. This is because it causes the opening of that door that separates the esophagus from the stomach. When this happens, the acid content in the stomach moves into the esophagus and causes all the symptoms we just talked about. Number 2, citrus fruits and juices. Grapes, pineapple, orange juice, these are all highly acidic fruits and therefore increases the acid in the stomach. Number 3, tomato and tomato-based processed foods such as tomato juice, pasta sauces have also significantly high acidic content, which worsens acid reflux symptoms. Number 4, carbonated drinks. Yes, fizzy drinks. It tastes good, but it causes an abdominal extension, allowing the acid content to move back up. Number 5, chocolate.
Yes, chocolate. I love chocolate.
But chocolate has a chemical in it called methylxanthine, which is similar to caffeine and worsens acid reflux symptoms. Number 6, peppermint, onions, garlic. This also causes relaxation of the sphincter. Number 7, spicy foods, greasy foods, fatty foods. These causes relaxation of the sphincter, worsening acid reflux symptoms. It also delays gastric emptying from moving food from the stomach into the small intestine. One more bonus point.
Try not to wear very tight clothing that puts significant pressure on the abdomen.
Because mechanically, you are putting a lot of pressure on the abdomen, which will in turn cause opening of the sphincter and worsen acid reflux symptoms. In summary, if you have acid reflux, avoid all these 7 foods we just talked about. Do not go to bed immediately after you eat. Try to give yourself approximately 2 to 3 hours after your last meal before you go to bed. If you do have to go to bed, try to sleep propped up approximately 30-degree angle. Oatmeal is a good alternative for breakfast. Avoid the milk, the sugar, the sun-dried fruits. Ginger root without caffeine, celery, lettuce, brown rice, and a tinge of olive oil are all relatively good alternatives if you have acid reflux. And yes, a glass of cold milk will suffice if you have an acute episode in the middle of the night. If after undergoing dietary elimination and following everything we just talked about and you're still having symptoms, I would highly recommend you talk to your primary care provider for further guidance and management, because we do have medications that can help alleviate your symptoms. If you enjoyed this video, like, subscribe, and turn on the notification button so you don't miss out on the next one. Dr. Juma, I'm out.